Dina Kulik joins me now. She's a pediatrician and founder of Kid Crew Medical. Dr. Kulik, thank you so much, as always, for giving us your time today.
No problem.
I want to get sort of your thoughts here, hearing what Dr. Moore has said. This is a strong recommendation, not a mandate. But we also know that Health Canada, Health Canada sort of has put forward saying, you know what, we want to do everything we can to sort of protect ourselves in this flu season. From your perspective, with the kids coming into your office, what are your thoughts?
It is definitely a very, very busy viral season for really a number of weeks. It never really went away. This summer was still very much filled with sick children. And as we're back in school and most kids are not masked at school and many kids are going to school sick, frankly, that is leading to this, crazy rise in number of viral illnesses. I do also very strongly recommend that kids wear masks at school. If you're older than 2, unless there is a contraindication, of which there are few, I do recommend kids be wearing masks, and their teachers and the educators and the administrators and adults that are in workplaces as well. It's very, very busy out there, and it's still relatively nice outside. As the weather gets cooler, we're going to be inside more, in close quarters more, and that's going to lead to probably an even increased rise of viruses. So when you can, keep a mask, keep distance, stay home if you're sick.
Can you give us a sense as to why so many children are getting these respiratory illnesses, or at least when they are getting sick, they are really, they're getting very, very sick compared to what we've seen in the past?
There's so many reasons for this. We don't know exactly what the cause is. Lots of people think it's because kids were not exposed to viruses as much when they were masked and when they were at home, of course. But we haven't been masked for almost a year now in Ontario schools. So I don't think that really is the answer. Some people think that COVID illness for most people have had COVID now, might be leading to a minimal suppression of the immune system, which can lead other viruses to make you more sick. I think a big reason is that the threshold to keep your child home now if they're sick is very high. I think many people are sending their kids to school sick and going to work sick, and so we're spreading viruses more. Whereas we used to keep our kids home sometimes when they were sick. Now, most people are sending their kids.
Yes, we're sort of getting more of that circulating in the air. And of course, a reminder again, I'm not talking specifically COVID. We're talking about the flu and the cold, RSV, which we know, that circulates in the air, and we've got to make sure we're washing our hands and disinfecting areas. We've talked about the shortage that we've seen with children's medication. We know that Health Canada's announced that they've secured a foreign supply now of children's acetaminophen. Your thoughts there? It's coming sort of in the next week or so, but it's not the full-on solution. It's, take what you need, but okay, doctor, I'm just going to have to hold you there for just a second there. We've got to pivot over to Quebec right now.